Just over 2 weeks ago, President Obama released his proposed 2013 federal budget. Our organization has a gigantic stake in the administration's budget as it affects the Department of Veterans Affairs. Our next guest is here to give us some background what the proposed 2013 budget for VA will hold for veterans and their dependents. He currently serves as the Deputy Secretary of Veterans Affairs, making him the Chief Operating Officer and the second highest officer in the agency. He has previously served as Chief Financial Officer and Assistant Secretary for Administration at the United States Department of Commerce, and as Deputy Assistant Secretary for Finance and Management at the United States Treasury Department. He is also a veteran of the United States Navy, having served on board a guided missile destroyer. As a Naval Intelligence Reservist, he was recalled to active duty during Operations Noble Eagle and Enduring Freedom. At this time, please give a warm American Legion welcome to Deputy Secretary of the Veterans Affairs, Mr. W. Scott Gould.
Nice to see you. Ken, thank you. Good morning, everybody. Good morning. Good morning. Good morning. Thank you, Ken, for that kind introduction. It's good to see everybody here this morning. National Commander Wong, whom I just shook hands with, Auxiliary President Nelson, National Adjutant Wheeler, Sons of the American Legion National Commander Roberts, members and staff of the American Legion. I understand that Representative Bob Filner will be here later on to receive an award from you if he's here. Good morning, sir. It's good to see you. It's a privilege to be here on behalf of Secretary Shinseki this morning. We both want to thank you for the opportunity to speak with you today. And I know that many of you now have gotten to know Secretary Shinseki in his role as the leader at VA, and you know what an extraordinary individual we have, someone who is deeply and personally committed to veterans issues and in serving veterans each and every day. He starts his day at 4:30. So we both salute the American Legion, your steadfast connection to the men and women who have given so much to protect our freedoms as a nation. Now, decorated Vietnam veteran and New York Times bestseller Karl Marlantes wrote in his book entitled, "What is it like to go to war?" that, and I quote, "Society needs veterans to express all sides of their experience, the guilt, the sorrow, and the pride. Cut off one, and you cut off the others." Veterans organizations such as the American Legion go a long way toward helping with the pride side and also providing a safe place for veterans. The American Legion provides safe places across the country for veterans. You leave no veteran behind in your round-the-clock work to make certain that veterans' health care and benefits and memorial services are fully funded and staffed by VA employees and supported by Legion volunteers who have only one mission: caring for our veterans. Secretary Shinseki and I join you in that mission. And tomorrow, when Secretary Shinseki and many on our leadership team are testifying before the Senate Veterans Affairs Committee on our fiscal year 13 budget, we know that we have your support. I believe that the President's budget for fiscal 13 and the advanced appropriation for 14 will uphold our joint commitment to care for those citizen soldiers who have borne the battle and for their families. The numbers look like this. The 2012 budget that we're currently halfway through executing, $126.9 billion. Next year's budget request, $140.3 billion. That's an overall 10.5% increase from this year's budget and a 4.5% increase in our discretionary budget. If you look at the delta between 09 and the 13 request, our combined discretionary and mandatory budgets will have risen by approximately 50%. These are unprecedented increases in our budget, and they are matched with unprecedented improvements in our financial management at VA to make sure that we spend that money wisely, reduce unnecessary costs, and free up funds to improve and optimize services for veterans. In other words, to provide those safe places that Carl Melantes was talking about, not only in our facilities, but in the meaning and the execution of our work. Today, I'd like to give you a brief state of the VA. I want to mark our progress, give you a snapshot of where we've been, where we are, where we're going, and to quickly review the past 3 years. Now, we started that journey 3 years ago by taking a long, hard look and listening to each of you about the things that we needed to do as an organization to get better. Today, we have 152 medical centers, over 800 community-based outpatient clinics, and 8.3 million enrolled veterans in our system. There are 280 veteran counseling centers, 58 regional offices to process benefits, 131 national cemeteries now burying 120,000 people a year. Our educational benefits extend to 950,000 veterans and family members, almost 1 million now. 1.6 million active individual home loans with the lowest foreclosure rate of any class in the country, and $1.3 trillion in life insurance coverage for over 7 million veteran clients, making us the 7th largest insurance company in America. In every instance, we identified and assessed our strong points, our vulnerabilities, and our weaknesses, and our introspection was focused on 2 pivotal questions. Where are we meeting veterans' needs? That's the essence of what we do. Or where, by contrast, were we meeting our own operational needs? The first is a good. The second is secondary. We also did a lot of listening to veterans and their families, to veteran service organizations like your own, to other stakeholders, and to our employees. And then we moved forward to develop a strategy for sustained, positive, and productive change. Actually, more than change, we talk about transformation in VA. We stepped up our op tempo. We established aggressive goals, which I'll talk to you about in a moment: homelessness, backlog, access. We used outcome metrics to measure our success. For example, posting all of our performance data for 152 hospitals on the web on a quarterly basis so that you and others can see and compare our performance between VA units and with the private sector. We strengthened our collaborations with other agencies of government, with the VSOs like the American Legion. And we made customer service job one for every VA employee. And to do that, we needed to train them in a new way of behavior, spending almost $300 million a year on training. We introduced multi-layered training all the way from the front line to our senior executives. We emphasized the delivery of informed, courteous, and compassionate service. And we defined our core values as an organization: integrity, commitment, advocacy, respect, and excellence. We call it ICARE, I-C-A-R-E, and it defines our values. It defines a standard of conduct, if you will, for VA, and it empowers VA employees to know, in the absence of guidance, what the right thing to do is according to our own values. And we have structured the systems, the business processes, and the technology to help support that. Today, NCA is the #1 customer satisfaction organization in America. Beats GE, Ford, Google in terms of quality of customer service. So we know how to do it, and we want to extend that to all the administrations in VA. In short, we've laid the foundation for a 21st century VA that's flexible, efficient, effective, and sharply attuned to the veterans that we serve. Now, the changes began long ago, but our efforts began 3 years ago to establish a future-oriented operating platform for VA, a platform that's values-driven, that is customer-focused, with an eye toward carefully preparing for a new wave of veterans, 21st century veterans, the men and women returning from Southeast Asia today and the ones who will return from duty 20 years from now. We're developing projections and plans and engaged in data collection. One example would be our Million Veteran program to advance genomic research, which would allow us to be able to identify trends in healthcare and call someone proactively on the phone. We noticed that you may, and have you had this test, and why don't you come in and see us? We've initiated a number of studies and analyses across the board to understand the needs of our veterans today and to anticipate those needs in the future. And we're also working on forecasting so that we can have the physical infrastructure, the people, the processes, the tools, and the resources to be able to meet the needs of over 1 million new veterans who were planned a year ago to join us, and add to that the additional 1 million veterans who will be coming into the system over the next 5 years as a result of the drawdown. Planning and preparation are obviously key to VA's success in the future, and that's what we mean by being future-oriented. As VA's guiding visionary Abraham Lincoln once said, "If I had 8 hours to chop down a tree, I'd spend 6 sharpening my axe." So within that framework, let me give you a rundown on some of our accomplishments. Healthcare access, the first of our 3 areas of priority. It's been a 3-pronged effort on facilities, programs, and technology. You get access to our VA by walking through a front door, but you also get access on the phone and the web. And when you get there in either way, physically or virtually, you got to have the processes and the people who know how to take care of you. We built more than 50 new community-based outpatient clinics in the last 3 years. We are constructing 5 new hospitals. For the Navy guys in the audience, these are our aircraft carriers. They're $600 million to almost $1 billion a copy when they're fully activated. Extraordinary resources, state-of-the-art, latest equipment. Our employees deeply involved in the design of the layout and the structure so that it serves veterans the best way we know how. We've invested heavily in mental health care. Today, our staffing level is more than 20,000, up from 13,000 just 6 years ago. We're aggressively treating PTSD and depression. And here again, technology is also helping. How many of you have apps on an iPhone or on an iPad? A couple of hands going up here, good. Well, we actually have an app for PTSD. It's kind of a handy and portable way. It's free. It's downloadable from the VA website. We'd invite you to use it. We are this year developing a family PTSD coach. As a father of 3 young children, I know that you can have a lot of stress in there. And so these are simple ways for us to structure the knowledge, the contact information, some of the techniques from meditation to hear the names of and numbers of the doctors you can call, to hear the communities that you can reach out to, VSOs and the like, to be able to join in the community, as Carl Malantis described in his book. We're increasing our resources for expanding telehealth. VA is the leader in telehealth in the country. When we last year had a convention of folks interested in telehealth and telemedicine, 300 companies showed up, generally regarding VA as the leader, certainly in terms of resources and in being telehealth and telemedicine ready. With respect to mobile vet centers, this year we're adding 20 mobile vet centers in a single year to the 50 that we've already got in place in the last 3. We are the leading user of social media in government today: Facebook, Twitter, YouTube. We have created something called a blue button technology, which was an idea 2 years ago, and will have over 300,000 users this year. This provides data that's controlled by the veteran for their personal health record. You fill it out once, it's yours forever. It's stored on the cloud, and you get to bring it to see the doctor, and you get to decide who gets the data and when they get it, under what terms. We have built a virtual lifetime electronic record, which is a multifaceted way of linking VA hospitals with private sector health care
and with DoD. Technology is the future. We are leveraging it. We are also building an integrated electronic health record with DoD. How many of you have traced for years the challenge that we have of getting a health record in DoD to the VA? You've heard about Alta. You've heard about Vista. How about this idea? Why don't we have a single electronic health record that is there in DoD and used by VA? And that's exactly what both secretaries have committed to, and we are building. We have already created the graphical user interface for that in North Chicago and in Tripler in Hawaii. We are already integrating the data elements underneath that, and together we will select the commercially available applications that would make that possible. We're also increasing our outreach to women veterans. 15% of the active duty force, 18% of Guard and Reserve. We have added 144 women program benefit coordinators at our key medical centers and all of our regional offices. We're addressing longstanding issues from past wars. You know, the Secretary took great personal pride and leadership in addressing the Agent Orange issue. You know that our Gulf War illness programs have now moved forward in a positive direction. There's structured recognition of the challenges that our veterans faced in the first Gulf War. And you know that we have changed the criteria for combat PTSD determination of disability by simply stating that a person has to have been in a combat environment and be exhibiting the symptoms. No more proving, getting the coordinates, where were you, was it this day or that day, completely unsat. VA's future forecasting, thank you. It was a big move, and it's helping a lot of people now. VA's future forecasting lessens the chance that 21st century veterans will be stymied by generational issues that their predecessors confronted. We're going at things like environmental contaminants and asking ourselves, gee, doesn't that problem look a lot like Agent Orange in Vietnam 50 years ago? And couldn't we be creating the registries and doing the research work that would then tee up the ability for the services to identify the people that were exposed and then help us serve them? To quote Carl Malantes again, many veterans from Vietnam, but also from Afghanistan and Iraq, are still waiting to come home. Veterans just need to be received back into their community, reintegrated with those they love, and thanked by the people who sent them. Now, switching from access to homelessness. In 2009, on any given night, an estimated 131,000 veterans were living on the streets. In 2011, that estimate dropped to 76,000. In 2012, thank you. I always go out, I do the point-in-time count in Washington, D.C., which means at 9 to 2 in the morning, just get bundled up. We did it in January, and you go out and count. And I'll tell you one quick story. We were out, not this year, but last year, and I finally ran into a homeless guy who was on the street, probably surprising, 60 years old. Man, just taking in their shorts, right? 60 years old, living on the street. I asked him, I said, are you a veteran? He said, no, but I wish I was. Those guys get treated right around here. It was very gratifying to see. We're really sort of saturating that we can help solve this problem. And in 2012, we think we're going to bring that number down to 60,000. Here are some of the things that we put in there. Outreach and education. We're focused on treatment and prevention, so it's not just the rescue. Let's prevent these folks from getting homeless in the first place. Housing and support services. Thank you. Community partnerships. We're working with the VSOs. We're working with the churches and the non-governmental organizations. We don't have a monopoly on this, but we can be a center, a glue, if you will, to structure and bring together plans and programs in each of the medical centers around the country. And our goal in 2015 is zero homeless. Those of you who are from the private sector know you set specific time phase and measurable goals. In government, you rarely do that. And part of the reason why is you don't control all the inputs that go into that. So there was actually a heck of a fight on this issue, which Secretary Shinseki led, and when he finally sat down with the president, had absolute agreement with him. We are going to say we're going to end homelessness by 2015, and we're going to find the money to be able to do that, and we're going to motivate and lead people around a real goal with a fixed timeline. And it shows a lot of courage in my view, and it is helping to galvanize action across the country on this issue. Now let me turn to the last area, which is benefits. VA has launched a campaign to increase the number of veterans enrolled in our e-benefit system. I don't know how many of you have been out and seen it. It's a DoD VA web portal. A lot of services on that. Members can access that and manage their benefits. Just last month, we adopted the same system that the banking system used to verify who you are, so you no longer have to go to a VA facility to show your two forms of identification and a signature. You can sign up the way that you sign up for a Bank of America or Wells Fargo. This was an idea in '09. Today, there are 1.3 million people using e-benefits. It is now mandatory for all active duty personnel to register in e-benefits, which means for the first time we have the ability to capture and record who that individual is, what their MOS is, where they're serving, and begin to help with that forward-leaning forecasting problem that we have at VA of anticipating what's happening at DoD and then being able to use that data and information. It's an important part of our customer service commitment to expand and modernize access. Put it on the web, click of a mouse. You can get your DD 214 off of that. You can get a certification for our home loan program literally in minutes. And we are also turning to claims backlog itself. Make no mistake, we have been attacking this for the last 3 years. The first year we had a big challenge put in our way, and that was called the new GI Bill. And we went from a standing start to a fully automated system with over 900,000 students in it today and almost $9 billion worth of tuition payments in 18 months. So while we were wrestling with that alligator, we were planning to do the takedown of the backlog. And now I'm pleased to report to you that last year, with a 27% increase to the VBA budget, we are within striking distance of being able to end the backlog. At the end of this year, thank you. At the end of this year, and as you undoubtedly heard from General Hickey yesterday, the end of this year we will have 16 locations across the country that have the new Veterans Benefit Management System. By the end of 13, this is the budget that we're defending before the SVAC tomorrow, we will have all of the regional offices on the VBMS system. Now, your first instinct might be, hey, they're going to solve that problem by the end of fiscal year 13. Our challenge is that at the same time that we have been deploying, training, building, designing the new system, the number of claims that have been submitted to VA has grown dramatically. Second straight year with more than 1 million claims. It's projected we will process 1.4 million claims next year. In 2013, that's a 19% increase in production over the last year, and we don't even have the new automated system in place. So we're going to have to work through that backlog, but the result of the new system, when it is in place, is we'll process every claim in no more than 125 days at 98% accuracy. Now, some would say, well, why 125 days? We set the standard using applying to college as kind of a standard. How many of you have kids college age? They go through this. How many of you have grandchildren? All right. So a couple out there, that's good. Well, you know how the process works. You kind of put in, they think about it. There's a lot of stuff that goes on, and then you get an answer. As long as you know you're going to get an answer in March or April, whatever, it's okay to deal with that. Analogously, there's a lot of work we have to do to make sure this is right, but it's an annuity that lasts a lifetime. It's going to last 50, 60 years when we make these decisions, particularly for the younger troops that are coming out. So we have a responsibility to do that carefully, and at 98% quality. That's the goal. That's what we'll achieve. I'd like to turn to something that most folks don't talk much about in a kind of a State of the VA address, but it's near and dear to my heart, and it's probably the main thing that I do at VA. And that's to talk to you a little bit about the business oversight, the management of this huge Fortune 10 organization with 314,000 people in it, 165 million square feet of real estate, literally tens of thousands of servers through this very, very complex system. And I just want to talk briefly, a couple of key issues. One is, how do you make decisions like that in an organization? When we came in, we were struck by how many senior execs said, I know how decision-making works in the VA. A couple people go into the deputy's office or the secretary's office, they make the decision, and the answer comes out. We don't do that. We have a structured process, an open process, where the senior people get to come in, and we foster a competition of ideas. And everybody around the table has a duty to dissent. And what I want to hear and what the secretary wants to hear, what's your best idea for serving veterans? And if that's a parochial view and it's not going to carry, I want to hear that idea over here and bring those two together and solve problems together. We have a very structured process for doing that now. The second is that we have clear goals and measurable objectives. We've published them in our strategic plan. You can see them in our performance accountability report on an annual basis. We are proud of them and our progress to reach them. We use performance measures. We use benchmarks. You will see with great frequency reaching out to the private sector and saying, what's the best standard in customer service and how can we meet or exceed it? We also use our past performance to improve our future performance. 3 quick examples. In the area of information technology, when we came on board in the first year, can you guess what % of the time our IT office met its schedule, budget, and quality goals? 30% of the time. 30% of the time. 2 years later, it's 89%. Thank you. When we get $1 from the taxpayer, we have a high probability that we're going to meet the stated goal. And the other 11%, we're working on that. I would tell you that the vaunted private sector is 76%. So we're really working this at a high level. In the area of financial management, we have enjoyed clean audits for a long while, but we've always had material weaknesses. When we first started, we had 4. Today, we have 1. We are committed to eliminating the final material weakness, which is in the area of what's called FISMA. It's the protection of sensitive information for our veterans and to make sure that private information is kept private. And I think we're going to crack that. And finally, in acquisition, can you believe that we were not pooling our purchasing so that we could drive through competition lower price and greater value? We've saved literally hundreds of millions of dollars doing that in the last 2 years. And finally, with respect to management performance reviews, our secretary sits down personally, began with a 4-hour meeting with every single vision director, that's 21 of them, and then brought most of the regional officers and the senior leadership team from VBA and sat them down, and we walked through every line of the budget. And then we took that budget and we matched it with plans and said, do they match? What's working and what's not? We do the same in the middle of the year, and we do it at the end. In the middle of the year, if we found unspent dollars, we redeploy them to do what? Serve veterans. And at the end of the year, we look back and go, how did we do? And what can we learn in the coming year to be able to improve our performance? So there are a lot of things that we've done on the management infrastructure, and I know that's not a usual topic for discussion on a morning like this, but I want you to think about that frontline employee or that management or supervisor, or you when you were in the service and you needed to reach back to that big logistics tail and pull forward ammunition, gas, food, shelter, or analogously software tools, or a new person that's got to be recruited, or the ability to speak publicly. All of those things are resources that we provide in support of the front line. And so it's very important in a large organization like VA that work well. Why? Because it helps us serve our veterans. So in conclusion, I'd like to say that we've made significant progress over the last 3 years in creating a better VA, a high-performing VA, a more responsive VA. We have much more to do, but we are making progress. We're looking forward to leveraging the initiatives that we built in the last 3 years in the 4th. And I speak for Secretary Shinseki when I say we also look forward to expanding and strengthening our longtime partnership with you, with the American Legion. I want to commend you for the work you've done for our nation's veterans for more than 90 years. You have helped to keep in the forefront of all you do the well-being of the men and women that have selflessly served our nation. You were there for them and their families, in good times and in bad, in war and in peace, in their youth, in their aging years, when the general public cares and when it's forgotten, and in good health and on their final day. The constellation by which you steer the Legion's mission, Americanism, children and youth, national security and foreign relations, veterans affairs and rehabilitation, and community service, merits our deepest appreciation. Thank you for the good work you do each and every day for veterans in your communities and here in Washington. And again, on behalf of our wonderful leader, Secretary Shinseki, I want to thank you for inviting me here today. Thank you. Thank you. Thank you very much. It's very kind.
Thank you.
Thank you very much.